if I told you sit down, for those people who usually go to clubs, and you order for a shisha pot and take that shisha for 1 hour, it is equivalent to the volume of smoke you will take in that shisha session. You'll be equivalent to the volume of smoke someone who has taken 100 cigarettes or even 200 may take. So, doctor, today, even without thinking about it, you've just taken a breath. And each and every other time you do breathe. But that one breath you take in air, and actually, it is completed by 2 organs, sets of organs within your chest, or thorax, if I may say, which are the lungs. Very many people don't think about those lungs, or they actually take them for granted, not until they find problems with them. I welcome you all to All Health, where we talk about health, real health, and we do share information to real people out there. Your host is Dr. Sulaiman Namoza, and I'm the real person talking to you. And the topic today we are going to be talking about is a very important one and a good one. We are going to talk about the air we breathe in, and even the lungs which take in that air. You know, someone in a day may take about 17,000 to 22,000 breaths, but without even thinking about it. Dr. Matovu is a medical doctor, a colleague, and a very intelligent person that I'm having on this podcast today. He's going to help us get the real, information about the air we breathe in and the health of our lungs. Our lifestyles, do we protect the health of our lungs, or we damage them? Dr. Matov, you're most welcome.
Thank you very much for your colleague Namoza Sulaiman, or rather Dr. Namoza Sulaiman. So thank you for inviting me to this podcast. This is a very very interesting topic, and I'm actually happy to be here with you, trying to educate the country, more about their health, endeavoring that we add a building stone onto the future generation, and we get a healthy future together. So the topic of discussion is very interesting, and it is a very close topic that I would like to say is close to my heart, or rather my lungs.
You've started right away with jokes.
Yes.
So doctor, thank you very much for those opening remarks. People do breathe, and even you actually hear you're breathing, I'm breathing, Yes. My producer, Dr. Enzyme there, he's breathing also on the camera.
Yes.
Yeah, so what I think we should start on a good note, or the positive ones.
Okay.
What are those good things you think someone should do to maintain a good health, or to maintain, or to keep, their respiratory system healthy, or their lungs very healthy?
Thank you very much for that question, Dr. Namoza. Our lungs, being a medical doctor or a scientist, is especially a human doctor.
Yes.
It is a very very prestigious aspect, or rather, it is I would call it an honor
to be a medical doctor.
To be a medical doctor.
Yes.
Because we deal with organs. And it is these organ systems that are combined to form. These organs that are combined to form like organ systems.
Yeah.
And it is these organ systems that are combined at the end of the day to form a human being. Because we have what we call the central nervous system, we have the respiratory system, we have the circulatory system, we have a lot of systems, the gastrointestinal
So damage to any.
So it is very paramount for us to understand how these systems work and dive deeper into the systems to organs. And now in one of these systems, the respiratory system, we find ourselves that the organ, or one of the major organs in this system, is the lung or lungs. So we have there's a term we refer to as bilateral. So we have the lungs are two-sided. We have the left and right. Yeah. So we not only have the only one side of the body, but we have lungs on both sides of the body. So this makes these lungs help us in breathing,
which is a very important thing.
Yes.
So how do you think someone could, protect them? What are those lifestyle activities someone could adopt?
Going back on that topic of how someone could protect their lungs, I wanted to first of all clarify about the role of the lungs.
Yeah.
What is the role of the lungs before we even protect these lungs? Because we have different body organs, and each organ has a specific function and or functions.
Exactly.
Some of our organs have more than one function, some have one function. But all in all, we have different organs. Different organs have different functions. One of the organs is the lungs. And what is the major function of the lungs? The lungs help us in breathing, or what
gaseous exchange.
what I would refer to as ventilation, and respiration. Yes. So
I get you.
Ventilation is a process by just like how you have ventilators on your houses, just like how you have windows on your houses, just like how you have doors on your houses.
But
so
for
if
us,
your house
we used to build those grass thatched houses in the villages, and we never put ventilators.
Still they are grass thatched, and it is they are somehow porous. They are somehow porous. So you have to have a way and an entry and an exit of air. So if we take an example that our bodies were our houses at home, these lungs are not the ventilators, but rather the ventilators would be the nose and the mouth, right?
Yeah.
But it is the nose or the nostrils and the mouth are taking this air that we breathe into the lungs. And what is one of the functions of the lungs? That brings me to the function of gaseous exchange.
Exactly.
So the whole system of the respiratory system, starting from the nostrils, the mouth, the trachea, the bronchi, the bronchioles, all of them are designed to direct this air that we breathe towards the lungs. And inside these lungs we have what we call alveoli, small structures that we call air sacs. They are air sacs. Air sacs or the alveoli. So the major function of the lungs, it is an organ that was designed in order for the process of gaseous exchange to take place there. So going back to your question of how could we protect the lungs?
Yes, doctor.
One way, I'm going to talk about like 3 ways in which the lungs could be protected, or in which you would ensure that your lungs are in a good working condition and they are healthy. One is by regularly exercising. So when you regularly do exercises like jogging, push-ups, exercises like motorbiking, people that do bicycles, so the different exercises.
Football.
Yes. Remember, whenever you do exercises, your lungs, your body will have a high oxygen requirement.
Exactly.
And this oxygen requirement will ensure that your lungs expand in order to take in more air. And whenever they expand, take in more air, in the long run, you will end up having healthy lungs because you're exercising them. I mean, these lungs, in order for them to expand, you use what we call muscles of respiration. And whenever you exercise, these muscles will be stretched. And at the end of the day, you will find that your lungs are being exercised and they're in a good functional condition. That is one. So that is upon it is upon everyone
to exercise.
Yeah, to exercise and make sure that we are healthy.
You know, people,
exercises help us prevent a lot of diseases. Prevention.
You know, the trend nowadays amongst youths here, you know, every person who wants to get some money, they want to buy a car.
Yes.
So you find someone, he drives week in, week out. You know, they don't go anywhere to play football.
They don't play football. They don't run.
They don't run.
Gym.
The only exercise they do is going maybe to clubs and you know.
Yes.
Yeah.
So really, we need to change our lifestyle and start exercising. The same about lifestyle. I would want to talk about a second way in which we could maybe ensure that our lungs are in good working condition, good health condition. Our lungs are intact, they are healthy, and they are protected. Another way would be ensuring that the air we let into our lungs is clean air.
Clean air? Clean air.
Because
how can you know clean air and unclean air or dirty air?
It depends on the environment.
Okay.
But it again depends on you to decide in which environment you want to be. That is one. So the environment you're going to be in can determine which air you're going to breathe.
Yeah.
So, for example, if you decide to cook in your house, for example, people who use charcoal stoves in their houses, you would have exposed yourself to an environment that is not healthy for your lungs, because this charcoal you're using to cook, and at the same time you're inside that house. It means that that charcoal has dangerous gases that might come from. Yes, that smoke contains gases like carbon monoxide, which are dangerous. We shall talk about the danger of that carbon monoxide later. But for now, ensure that you're in a good environment. Second, how would you ensure that you breathe good air? Don't smoke.
Okay.
Ensure that you don't smoke. Some people deliberately decide to smoke. Because you can make a decision that I'm not going to smoke, but people decide that I'm going to smoke, and at the end of the day it ends up affecting their lungs, because that smoke also contains dangerous substances that maybe we shall talk about.
Okay.
But another way that you could protect your lungs is hydration.
Yeah.
Hydration, ensuring that you take enough water.
Okay.
Hydration does not only help protect the lungs, but even all other body organs. So whenever someone is taking enough amounts of water, it ensures that the mucus lining of the airways of the air sacs, because these air sacs where gaseous exchange takes place, they have a mucus lining that's supposed to be maintained wet. Are we together?
Yes, doctor.
And or moist. And where would you get moisture?
Nothing.
It's from water. So you have to make sure that you take enough water or enough drinks and ensure that your body is hydrated. It would be also another way of protecting your lungs.
Okay.
Yes.
Thank you very much.
There are very many ways in which someone could really protect their lungs, but the active ways is by exercising and also by ensuring that you don't take in dangerous toxic gases into your lungs.
Exactly.
At least that's what you could do for yourself. Yes.
Thank you very much, doctor. I think also from the little knowledge I have, I would add something like, you know, if at all you have a chance of avoiding those respiratory infections.
Yes.
Things like TB.
Yes.
Flu, especially there is that flu which comes and it doesn't go. Cough, you know.
Cough. Those viral upper respiratory tract infections, plus also infectious diseases that affect lungs, like TB, like we have some other infectious diseases like herpes, so hepatitis, but all in all, ensure that you prevent. For example, if it is for TB, you could try to avoid contact with TB persons, people that have
Put
TB.
on face masks.
Ensure that you have face masks.
Yeah.
Avoid dusty environments. We have people that work in those extraction sites, like quarrying sites, where they go, they mine gold mining sites. One of the ways in which you could prevent interstitial lung diseases of the lungs is by at least ensuring that even if you're working in those environments, don't work for too long in such environments, and at the same time ensure that you're seeing pulmonologists to check
your respiratory health.
Yes, to check, because those are some of those. There's a condition called silicosis, whereby if someone is working for a long time and is exposed to some of the silica, it will the silica meaning because the condition is silicosis. So we have different silicon based chemicals that are in those mining sites, that are in some working environments, and
people get exposed to them.
Yes, so people in an endeavor to prevent or to protect our lungs, we need to also sensitize some of those people that work in some of those environments that have those chemicals to reduce that exposure. If you're to work for 10 years, you reduce and work for maybe 2 years, and maybe look for another,
gather some capital.
Yes,
you
look
for
another,
start up a chapati store.
Exactly.
Okay, thank you very much, Doctor. I want us to dive into something very common actually. You find parents at home, especially fathers, they do it openly, even with children around home. Actually, even most of them even do it within houses.
Yes.
That is cigarette smoking.
Cigarette smoking, yeah.
Doctor, when someone smokes or takes in that cigarette smoke,
yes,
what happens to it when someone actually takes in that smoke into their bodies?
Okay. Thank you very much again for that question, Dr. Namoza. When someone inhales smoke, what happens?
Yeah. What happens?
What happens? Because I would start with what happens when we inhale this air. What happens when we inhale this healthy air, this one?
The normal air.
The normal air we inhale. What happens? That's what I would start with.
Yeah, true.
What happens is that air will travel through the different structures of the respiratory system, the ones we talked about.
The ones we talked about,
starting with our nostrils, our mouth, because these are all
inlets.
Yes, inlets. So it means that there is intake of air, and if it is healthy air, how will it travel? It will go through the nostrils into the windpipe, or what we call the trachea. That windpipe will take this air. The windpipe divides into two, one to the left, another one to the right, and they're also like pipes. So the divisions or the conduits of this when this the windpipe or the airway divides into two, and this conduit goes to the right, this conduit goes to the left. The conduit that goes to the left also further divides into other subdivisions.
Smaller.
Yes, that end up going into air sacs at the end of the journey. Yeah, and also this side also, it also divides further, subdivides into bronchioles, and these bronchioles end up dividing into the different air sacs. So now the air sacs is like the dead end of the windpipe.
Yeah. So,
but what happens there at the air sacs? At the air sacs, beyond the air sacs, we have what we call blood vessels or capillaries. These small, tiny blood vessels where gaseous exchange takes place. Yeah. So that means that if a normal person inhales air, this normal air, it will go through that journey we've talked about until it reaches the air sac. And when it reaches the air sac, we shall have gaseous exchange taking place. Yeah, at the alveoli or at the air sac. And this gaseous exchange, what do we mean by gaseous exchange? The dirty carbon dioxide that, because when these body cells of ours respire, or when respiration takes place, they produce a gas called carbon dioxide, which is a byproduct.
Yeah, true.
And that byproduct needs to get out, and it goes out through the lungs. And still, we need to inhale the clean, good oxygen, and that oxygen also goes in through the lungs. Yeah, that's why when we are ventilating, we have an inhalation phase and also an exhalation phase. So in the inhalation phase, you're taking in the good clean oxygen, and in the exhalation, you're taking out the dirty byproduct carbon dioxide.
Yeah,
so when we breathe in the normal air, it will follow through that journey until it reaches the air sac where gaseous exchange takes place, and at the end of the day, we shall have the clean air going into the cells, that is the oxygen for respiration
Yeah, true.
and the dirty air coming out. So what happens
To the smoke.
to the smoke that enters?
Mm.
The smoke that enters will also follow the same route.
The same
because
route.
it is anatomically we've explained that the air goes through the trachea,
Up to the
which
sacs.
bifurcates and goes it and ends up leading into the air sacs.
Yeah.
So it means that most probably, or actually, this air is going to also do what? Follow the same route.
The smoke.
Yes, this smoke. But the problem with the smoke that
Mm.
people smoke is that it is not clean air like
Yeah,
the
true.
one we are talking about.
Mm.
It is a smoke air that contains dangerous substances. Some of the substances that are contained within the smoke, for example in the cigarette, because most people smoke cigarettes. Some people smoke shisha, but most of these contain tobacco.
Yeah, true.
And in this tobacco we have different
Chemicals.
chemical substances that are dangerous, dangerous substances,
Yeah.
and or what we would call toxic substances. Substances like carbon monoxide, substances like nicotine, substances like tar, and we have cancer. It is a fact that some of this smoke from cigarettes and other tobacco containing substances, it contains cancer-causing agents, or what we call carcinogens.
Yeah, true.
Agents that could cause cancer, about like 70 agents in that smoke.
Yeah.
And also, so it contains cancer-causing agents. Are we together?
Yeah,
so
true.
This smoke is
So
not
we shall
clean
have those chemicals entering into the blood.
into the blood.
And
Yes, along with the normal air that has entered, this smoke that contains all these dangerous substances
yes.
will enter into our blood, and it will and what happens beyond that? It will enter into some of these dangerous substances will start entering into our organs.
Okay, thank you very much.
Along
Doctor.
with
So,
the gaseous exchange.
at that very point, when those dangerous chemicals have gotten into the blood, I'm very pretty, they will have effects
Yes.
on our bodies.
Yes.
Or on the body of that person smoking.
Yes.
And I think, to be clear, let us split those effects into the short-term effects and the long-term effects.
So thank you for having that sense of precision. We want us to divide them into short-term and long-term effects of some of these substances to our body. The short-term, first of all, within hours to weeks of inhalation of some of these toxic substances, we could have effects in our body.
Yeah.
Yeah, some of the effects depends on the substances that are contained within this smoke.
Yeah.
Some of the substances is, for example, carbon monoxide are dangerous. How? This carbon monoxide is a toxic gas. And this gas, how toxic is it? It is a gas that has high affinity. Because when gaseous exchange takes place and the normal oxygen enters our blood, in our blood we have transporting cells called red blood cells. These red blood cells have a pigment or a substance called hemoglobin, which hemoglobin has in its structure, it has in its center there is a structure called heme. That heme it is like iron 2. Those who know chemistry, that iron 2 combines with oxygen, and it
carries
there is a term we call affinity, oxygen affinity. So that hemoglobin, because of its heme, it has more affinity for oxygen. Or this this iron will combine with the oxygen to form iron oxide. So that's how, yes, oxyhemoglobin, and that is how this iron is what? That is how this oxygen is transported in our blood vessels. It is transported in our red blood cells in hemoglobin, and oxygen transporting pigment. But you find that there is a gas called carbon monoxide, which even has more appetite or affinity for this hemoglobin. So what happens when you smoke? That smoke contains carbon monoxide, a dangerous gas that has more appetite for our hemoglobin. It means that a certain percentage of our red blood, of our hemoglobin in the red blood cells will transport carbon monoxide rather than transporting oxygen.
Yeah.
And in it having more affinity for this carbon monoxide the hemoglobin does not easily release the carbon monoxide.
Even in the presence of oxygen.
Even in the presence of oxygen.
Yeah.
So you will find that we shall reduce our oxygen transportation capacity when we have this carbon monoxide. That is one.
Okay.
Another substance contained within this smoke is nicotine. This nicotine is a substance that affects our heart rate and our blood pressure.
Yeah, true.
So at the end of the day, this nicotine will affect our blood pressure and our heart rate. It will increase our heart rate.
Yeah.
Yes, so within hours to weeks, you'll find that someone's blood pressure might be affected because their heart rate is affected. I mean, when you affect the heart rate, you affect the blood pressure at the end of the day. And long term,
yeah, long
term at the end of the day, you might find someone getting heart disease. You might find someone getting heart disease. Most cancers come from especially cancers of the lung. For example, like lung cancer. This lung cancer comes from these cancer-causing agents found within this within this smoke. In the smoke, we have about 70 cancer-causing agents, or what we call carcinogens.
Yeah.
And we have chemicals in this smoke that impose a long standing effect on our bodies in terms of causing cancer, in terms of causing hypertensive diseases like high blood pressure, and also we also get depending on who is smoking. If someone is pregnant, it could have effects on the pregnancy of someone.
Okay.
In terms of bringing congenital anomalies, ranging from bringing congenital anomalies to bringing miscarriages. So it is not very safe out there for people who smoke, both short term and long term. Yes, doctor.
Okay, thank you very much, doctor. Actually, for me, the patients I usually get that are actually having that history of smoking.
Yes.
I usually tell them the best way you can work around that smoking habit of yours is to stop.
Yes.
Because I usually tell them the body starts healing as soon as you stop smoking.
Yes.
Because that carbon monoxide thing you've talked about.
Yes.
I'm pretty sure if I told someone stop smoking,
yes,
that means
there are some things we've not talked about. I've left out. Things like, because this smoke is dangerous, in a way that it will short term, it will cause inflammation.
Okay.
And it will cause irritation of the airways. And this irritation and the inflammation of the airways chronically, it will give us diseases like COPD.
Yeah.
COPD, chronic obstructive pulmonary disease. And this COPD, the diseases in it, majorly we have emphysema or emphysema, and also chronic bronchitis.
Yeah.
Chronic bronchitis meaning inflammation of the bronchi chronically over a long period of time. There will be fibrosis of this. Fibrosis meaning hardening of the bronchi. And remember, the bronchi have to work in a way whereby they can expand, because you're inhaling. There should be free expansion and contraction.
Okay.
Are we together?
Yeah.
So at the end of the day, if the lungs can't expand freely and also contract freely, or relax freely, it means that you will have a problem.
Okay, thank you very much, doctor. I think at that very point we are going to take a short break.
Okay.
Then we shall be getting back.
Okay.
The last part. Okay. Thank you very much, our dear viewers, and I welcome you all from that short break. And I also take this opportunity to welcome those people who have just joined in on this podcast. It is all health. All we talk about is health. Bring information to you. And today's podcast is about the health of our lungs and, the air we do breathe. And the host is Dr. Sulaiman Namoza, the voice you're hearing. And the person today I have hosted is Dr. Matuvu Ismail, a colleague, and a very intelligent medical doctor around Kampala. Doctor,
Yes.
without wasting any single minute, I want us to dive into the point of shisha and cigarette smoking.
Yes.
Nowadays the trend is, very many youths or young people around Kampala and even the different cities around Uganda.
Yes.
The trend is now changing, If at all people go into clubs,
Yes.
you really see smoke around all over. People are taking shisha. And the myth around it is that people say shisha is just, water moving within a pipe or flavored water, water vapor.
Yes.
I want us to set the record straight and clear today.
Yes.
Is shisha really harmful or not harmful? And is it more harmful than cigarettes or less harmful than cigarettes?
Okay.
Yeah.
Thank you very much. Our dear viewers, I would want to elaborate more on this myth that shisha is not harmful or shisha is harmless, like some people say. Do you know that the World Health Organization, the World Health Organization estimates that for a person smoking shisha, having a 1 hour session of shisha smoking, the volume inhaled of the smoke in a 1 hour session of shisha is equivalent to the same smoker taking cigarettes, but taking cigarettes, 100 cigarettes.
100 of them?
Yes. So the volume one inhales while taking 100 cigarettes. The World Health Organization estimates that it is equivalent to the same amount of volume a person taking shisha for 1 hour inhales. So what does that mean?
Most of the people who go to clubs understand Luganda. Kyotegeeza omuntu atudde n'anywa shisha okumala essaawa emu yenka omukka gwayingiza mu mubiri gwe gwenkanankana n'oyo omusajja atudde n'akuba eminwe gya sigala 100.
Kati
ekyo nga kikambwe.
Kikambwe. Because when you move around, and it is very concerning actually, we are talking about this. Some of these things are not supposed to be talked about while we are smiling, because at the end of that day, it is not, it is dangerous. Yes. So coming back to your question, I think you wanted me to
is shisha harmless, as people say? Is it just water vapor that is flavored?
Shisha is not just water vapor, because shisha contains tobacco.
Okay.
Shisha, mushisha batekamu taba. Some people batekamu nenjaga. Some people batekamu ne flavors. I don't know the different flavors they put. But I'm told we baba balunge yo shisha, ingeri je bakikolamu, batekamu ebintu bingi. Muli tobacco. As long as mulimu tobacco, taba, as long as mulimu bintu ngenjaga na biri mu shisha omo,
it is deemed dangerous.
You can't say that it is not dangerous.
Okay.
And this is a large pipe someone is using, a mouthpiece someone is using to smoke. Nene nnyo bweti. So kitegeeza ki? Kitegeeza nti sigenda gama mu shisha asinga sigala okubeera dangerous. Oba sigala asinga shisha okubeera dangerous. Both of them are dangerous. Kyenjagala nsooke empiseewo. That's a fact.
Okay.
Both shisha and cigarette smoking are not good practices. Both of them
are dangerous vices.
They are not. Yes, they are not harmless, like some people say. So both of them are dangerous and harmful. But now, like I told you, the World Health Organization estimates that a person having a 1 hour session of shisha smoking is inhaling in a certain volume. But that volume is equivalent to the same amount of volume someone inhaling cigarettes, 100 pieces of cigarettes is inhaling.
Okay.
So gwe kikubye okubamu akafaananyi nti otudde wali you're smoking your shisha for 1 hour. Mu kaseera ke kamu wenkanankana n'omuntu atudde awo mu kifo kye kimu n'akwata eminwe 10 egya sigala n'agifuuwa. not in terms of the danger but in terms of the volume gy'oyingiza. Omuntu bw'atuula wansi n'asmokinga eminwe 100, actually it is estimated that it's a range from between 100 to 200 cigarettes. Nti omuntu ng'atudde awo mu katebe n'ateekako omunwe gwa taaba ogusooka ne gugwa wali, n'ateekako ogwokubiri ne gugwa wali.
Of which a normal person cannot do that in one day.
Sisuubira nti omuntu asobola okufuuwa
taking 100
eminwe gya sigala 100 mu lutuula lumu. Sina in a day, mu lutuula lumu.
It can't happen.
N'atuula n'afuuwa sigala gwo ne gugwa, n'ateekako ogula gwo ne gugwa, n'ateekako omulala. You get?
Yeah.
So at the end of the day, the fact is that if you get that World Health Organization estimation of the fact that someone taking shisha in 1 hour, 1 hour session of shisha is equivalent to someone who has smoked 100 pieces in terms of volume inhaled. It is not something that you can overlook.
Yeah, true.
It is something serious. So you can't stand out and say shisha is not what? Is not dangerous.
Yeah.
When a person taking shisha in an hour is equivalent to someone who has smoked the volume they inhale in an hour session of shisha is equivalent to the same amount of volume someone taking cigarettes, 100 pieces of cigarettes is inhaling.
Okay, thank you very much, Doctor. So basing on that, it actually implies that the side effects that we've talked about of cigarette smoking are more or less the same to those of someone who is taking shisha. But what could be some of the other unique, risks associated with shisha smoking, apart from, the lung cancers we've talked about,
So first of all, someone taking a piece of cigarette can take it for approximately 5 to 7 minutes. The puffs. Someone can take like about 12 puffs, I think.
Yeah.
About 12 to 20 puffs of smoking. Then at the same time, it will take them like 5 minutes to complete a what? A cigarette piece. So, but someone taking shisha, say for example over an hour, will take more than, I don't know how many puffs.
More than even 80 puffs.
They will take like about 80 puffs plus. They will take a lot of puffs, and each puff will contain a huge amount of volume compared to someone taking cigarettes.
Yeah.
So, what does that mean? Remember, the shisha someone is taking contains tobacco.
Which is also in the cigarette.
Which is also in the cigarettes. So it means that more or less, the problems someone taking cigarettes is exposed to
in a week.
In a week, in
this
a month.
This one can get exposed to them just in an hour.
Yes, the same problems the person taking cigarettes is exposed to, the same exposure someone taking shisha is as well exposed.
Okay.
So it means that the risk actually of taking shisha might even be bigger because you're taking in large amounts of volume over a small period of time. Okay,
doctor. So in clubs, usually the trend is, if someone goes in a club, they buy a pot of shisha, they go as a group.
Yes.
So you see people are sharing.
Yes.
Is that of any danger?
Yes, of course. So shisha has even extra disadvantages. Yes, it is compared to cigarette smoking. It carries more volume of inhalation, but at the same time you will find that it has sharing. That someone using this mouthpiece will, after inhaling or taking some puffs, will also share the same mouthpiece to another individual or to another friend, and that same friend will also take. So it means that if this person has infectious respiratory diseases, like for example TB or flu or other diseases that are infectious, hepatitis, herpes, that person currently will have Ebola training.
Very contagious disease.
Yes, it means that that person is at risk of also transmitting the same disease to their counterpart.
Okay.
Also, shisha is prepared using charcoal, right?
Yeah, true.
So that charcoal they use, it even has more amounts of carbon monoxide gas, the dangerous gas we talked about that has high affinity for our hemoglobin.
Mm.
This charcoal that they use to prepare the shisha, because I see they put for them charcoal.
Yeah, true.
And that charcoal they use to, because it has carbon monoxide, it is charcoal, for God's sake. So it has carbon monoxide gas in large amounts, even compared to the carbon monoxide in the cigarette.
Okay, thank
so
you
it
very
means
much.
that they're inhaling a lot of carbon monoxide gas which is toxic, and it renders people who smoke shisha at even a greater risk of exposure compared to the, I think, people who take cigarettes.
Okay.
So they are both harmful. They are both harmful, and I would not advise any of my colleagues or any of my friends to make it a habit to continue smoking.
Okay.
Or to start smoking.
Thank you very much, Doctor. As we are concluding this session,
Yes.
you know,
Yes.
we don't just say someone is smoking a lot.
Yes.
You know, there are ways of measuring the smoking history of someone,
Yes.
of a person, or of a chronic smoker, or someone who has been smoking for some time.
Yes, doctor.
I want you to enlighten the people who are, you know, on this podcast viewing. What are pakias?
What is a pakia? What are pakias?
Yeah, what are pakias, you know? And how are they used to measure the risk of someone getting lung cancer?
Okay. So, like you said, in medicine, it is an assessment tool.
Okay.
Pakia. Pakia, P-A-C-K. Pack. Coming from the word pack. Pack, just pakia cigara. Yes, pakias. So it is pakia is a technical term used to. It is a risk assessment tool where we want to know in a day an individual takes how many cigarettes. Are we together? In a day, if a person has smoked cigarettes for their entire life, say for example someone is 50 years and they have smoked cigarettes, they started smoking at like 20, it means they have smoked for 30 years. We want to know their pack years. What is pack years? Pack years means that we want to know in a day someone takes how many pieces of cigarettes. And you find that in a pack of cigarettes, the total number of cigarette pieces in a pack is 20.
Yes.
So we have 20 cigarettes in a pack.
Mm.
So if someone was taking 20 pieces of cigarette every day, it means they are taking a pack every day.
A pack of
One pack
per day.
A pack of cigarette per day, it means you're taking 20 pieces per day for
a full year.
So there is a formula that we use to calculate. We say number of cigarettes per day out of the number of cigarettes in a pack, which is 20, times the number of years someone has smoked. So if someone has smoked for 1 year and they are smoking, say for example, 20 cigarettes every day, it means that they are smoking 20 cigarettes out of the 20 that is in a pack. That is 20 out of 20, which is 1 times the 1 year, which means that their pack year is what? 1. It means that if someone has a pack year, which is, if someone has pack years which is 1, are we together? 1 pack year, if someone has 1 pack year, it means that they have smoked 20 pieces of cigarettes every day for 1 year. Are we together?
Yes.
So if someone has smoked 10, okay, 40, let's say 40 pieces of cigarettes every day, it means that they are smoking 40. If we have to calculate their pack years, we shall say 40 out of 20, 20 being the number of cigarettes in a pack. Because all we want to know is how many cigarettes do you smoke a day. Those number of cigarette pieces out of the total in a pack, which is 20, times the number of years we've done what? We've smoked.
Okay.
So if someone has smoked 40 pieces of cigarettes every day, it means it will be 40 out of 20, which is 2, times, say for example, they have smoked for how many years? Say for example for 20 years.
For 20 years.
So it means that we shall have 40 out of 20 times 20.
Exactly. Which is 40.
Which is 40.
Pack years.
And the way we assess our risk is that if someone has pack years of 20 and above, it means that that person is at risk of getting lung cancer compared to someone who is not smoking. He's at a risk of 3-fold of getting lung cancer compared to someone who does not what? Smoke. It means that if someone was smoking 40 pieces of cigarettes over the past 20 years, it means that it is 40 out of 20, 20 being the total number of cigarettes in a pack. So it is 40 out of 20 times 20, which means that is 40. So 40 means that that person has pack years which are above 20.
Which are above the threshold.
Which are above the threshold, meaning that they carry a very huge amount of risk of attaining lung cancer compared to a person who has who has their pack years below 20, or someone who is not even smoking. But you having pack years below 20 does not mean that you're not going to get what? A lung cancer. That is just a risk assessment tool that is used.
Okay.
Are we together? From the research, but it does not mean that it is very accurate, and it does not mean that it will rule out someone who has pack years below 20 of attaining lung cancer.
Okay, thank you very much, Doctor. I think it has been a very, very, wonderful session.
Yes, Doctor.
So as we are concluding, does it imply that someone who has been taking 40 cigarette pieces
yes,
for 10 years has the same risk as a person who has been taking 20 cigarette pieces for 20 years?
Pardon?
Because someone has been taking 40 pieces of cigarettes for 10 years.
20 pieces, 40 pieces.
40 pieces for 10 years.
Yes, for
Then
10 years.
20 pieces for 20 years.
Then 20 pieces.
For 20 years.
So this is how it works, okay? Like the pack years I was talking about, because we have short-term smokers, but when they smoke heavily.
Heavy smokers.
Heavy smokers for a short period of time
and
versus light smokers for a long period of time.
Yeah.
So these pack years, it will help us. For example, someone who has smoked heavily, meaning that they are smoking 40 pieces, because someone who smokes 40 pieces of cigarettes a day, that one is a heavy smoker.
Yeah, true.
For 10 years.
That's a heavy smoker.
That is a heavy smoker. Their period of smoking just 10 years, but smoking 40 pieces. So that means that will be 40 out of 20 times 10, which will be
20 pack years.
20 pack years, right? Compared to a person who has been smoking 20 pieces for 20 years. That means that they are smoking a bit lightly compared to the one who smokes 40, but now for 20 years, which is a longer period of time. It means that this person is smoking 20 pieces a day, which that is one pack. So 20 out of 20, which is 1 times 20 years, because they have smoked for 20 years. So that means that they both have a pack years of 20.
Yeah, true.
The one who has been smoking 40 pieces a day for
10 years.
For 10 years.
And the one who has been smoking 20 pieces a day.
Yes, compared to the one who has been smoking 20 pieces a day
will end
for
up having
20 years. They both have pack years of a pack year of 20.
Exactly.
Meaning that they are both at the end of the day, they are both exposed at the same risk of acquiring lung cancer.
But the other one will be a heavy smoker and the other one will be light smoker.
Yes, the one who has smoked heavily and quitted.
Yeah, true.
And the one who has smoked lightly and quitted, but for a longer period of time, they are so it means that over a long period of time, your pack years will do what? Will increase, even if you're a light smoker. And you'll be at a higher. It means that someone who has smoked for a longer period of time will also be at a greater risk of acquiring the what?
Okay.
Acquiring cancer.
Thank you very much, Doctor. So, what are the closing remarks?
Closing remarks.
What could what closing remarks could you give to those people who are watching this podcast?
Yes.
As we are closing off.
So my parting shots, one, is that I'm going to talk about the people who have not yet started smoking. Please don't start. Don't start. If at all you could prevent it, prevention is better. If you know you've not started smoking, desist from the vice.
Okay.
Don't start. It would be the best solution. To those who have been smoking and continuously been smoking, you could stop today. Because the difference in because for someone who has stopped today, it means that even the toxins, that the exposure toxins would have stopped.
Yeah, true.
The reversal will start. The reversal to the exposure will start immediately. Yes.
Okay.
So if for someone who could afford to stop, please stop today. I encourage you to stop.
Okay.
Even the addiction, the person who is addicted, you could start by reducing. If you've been taking 10 to 20 pieces, you could start by reducing them to 5.
Okay.
Because it is a habit. Smoking reaches a period when it is a habit, and it becomes like very hard for someone to quit. But we are here with words of encouragement that many people have stopped smoking. You could stop as well today.
Okay.
And I'm here to emphasize the fact that the reversal of the exposure to the toxicity could begin even hours after stopping the vice.
Thank you very much.
And for people that have acquired lung cancer, that have already acquired the disease, we stand in solidarity with you, and we really hope that you're getting
we sympathize with them.
We sympathize and empathize with them, because we hope that they are getting the treatment they're supposed to get. Yes, and I assure you, Dr. Namoza, when you go to Chirudu or Mulago, when you go to their Palmo or their pulmonology unit, you will find there a lot of people that have most of them, when you're assessing, when you're taking their history, they will tell you that, doctor, for me I was smoking. For the past 20 years I was smoking.
Yeah, true.
I just stopped recently. I smoked for 30 years. They are there. And most of them are those people that go to bars. You find there the sex workers, most people that have a lifestyle that is at risk of being exposed to this partying life. So you'll find that most of them are in the hospitals.
Okay, thank you very
so
much.
This vice, it means that it has already produced results. We already have people that have succumbed to the outcomes of the smoking. So if you could stop today, someone who has started, please stop. That is my best advice to a person out there who is wishing to start to smoke or who has already started smoking.
Thank you very much, Dr. Matov Ismail. We've had it all. The lungs you have are irreplaceable. You can't replace them like you replace a battery in your phone. And yes, we shall always be here to, share with you information that is very important to your health and to your daily lifestyles. It has been all health. We only talk about health, bring health information close to you. My name is Dr. Namoza Sulaiman, and I've been with Dr. Ismail Matovu. Thank you very much.
Thank you.